Today we're highlighting Dr. Zalek, a neurologist who cares for patients with conditions that affect the brain, spinal cord, and nerves. He diagnoses and treats disorders and other neurological conditions. By using specialized tests, creating personalized treatment plans, and helping patients manage their symptoms, neurologists work to improve brain health and enhance their patients' quality of life every day. Can you tell us a little bit about what a neurologist is?
A neurologist is a doctor who helps people who are having problems with their nervous system. And the nervous system includes the brain, the spinal cord, the nerves going out to the muscles, and the nerves that control sensation. And so it involves a lot of different things of how a person interacts with their world.
What does a day in your life look like?
A day in my life is a little different than the typical neurologist. Neurology has changed. Some neurologists primarily work inside hospitals in emergency rooms, taking care of patients in the hospital. And then other neurologists, they work in an outpatient clinical setting, taking care of patients who are not in the hospital, but instead are experiencing their neurologic conditions at home. My practice at this point also involves collaborative research with engineers from the University of Illinois, so I'm kind of not doing a lot of the typical clinical neurology stuff. Right. So an inpatient neurologist, what they'll do is come into the hospital in the morning, see patients who have been admitted to the hospital overnight, and then also see any new patients coming in through the emergency room that have severe problems and get them admitted, and then take care of the other patients that are already in the hospital to try to get them home or to where they need to be as soon as possible after getting them treated. Those days are typically 12-hour days. There are some situations where it's 8-hour days, and depending upon which hospital you work in, there may be some teaching involved with medical students or residents. That's what we do here. And then for outpatient clinic, again, it starts at 8 a.m. You work with your team initially in the morning and then start seeing new patients and also follow-up patients. And there may be some diagnostic testing that you provide during that day also, and then finish up other computer tasks and hopefully home by 5 or 6.
Why did you choose to become a neurologist?
I chose to become a neurologist because it involves interacting and working with people. I like that connection with the people, and it's also a big puzzle solving challenge. And so it's a great combination of both of those things, of being able to connect and work with people and also solve interesting puzzles.
What is your favorite part about the job?
My favorite part of the job has evolved or changed throughout my career. Initially, it was the combination inpatient and outpatient work, and also doing a specific type of test called nerve conduction study EMG, which is kind of a short little one-piece puzzle to solve for one patient at a time. And then more recently, it's doing this innovation work with the engineers that I find most fulfilling.
What advice would you give students interested in going into healthcare?
The advice I give to students interested in going into healthcare is to explore all their different interests and not close down on one area right away. You don't need to specialize right away, and also recognize that there's this great opportunity throughout your career to kind of reinvent yourself and follow where your interests go, and also emphasize developing leadership skills and communication, because that is super important for helping to care for patients and making the system that you work with better, and overall leads to better career satisfaction, I think.
What is something that people are surprised to learn about your profession?
I think people are surprised to learn about two things with my profession. One is that it's become so complex. It's sort of like internal medicine, where there used to be only just internal medicine doctors, but now there are doctors that just take care of the heart problems, the lung problems, the kidney problems. That same thing is happening in neurology because it's becoming much more complex. And that second thing that's surprising is that there are so many treatment options. In the past, the stereotype was neurologists could diagnose what a person's problem was, but couldn't help them to get better. And this field is rapidly advancing. That's what's surprising people. There's so many different treatments out there, and it's to the point where I wish I was starting neurology now versus when I did 25 years ago, because it's such an exciting field.